Hi, this is Ryan Kelly, Managing Editor for the Journal of Emergency Medical Services, and I'm here with Brett Patterson, who is of the International Academies of Emergency Dispatch, and he is one of the winners of EMS10 Innovators in EMS Award for 2016. Welcome, Brett. Nice to meet you.
Thank you. Thank you very much.
So you won this award for some innovations in emergency medical dispatch. Can you tell me about the latest version and what you've done with it?
Well, the science has been kind of interesting over the last few years because it's shown us how important BLS, or basic life support, is in survival from cardiac arrest. And part of that is getting CPR, hands on chest, on the patient early in the process. So we've had medical directors, field people coming to us and saying, you know, we can't be there for the first 8-10 minutes. Mm-hmm. We really need you to affect these survival rates. And we've sort of known this anecdotally for a long time, but when I became a paramedic in the 1980s, it was all about innovation and drugs and so forth. And now with this new focus, we're getting a lot of support, if you will, from field providers, medical directors, and so forth. So we're looking at ways to improve dispatch protocol to, number one, recognize cardiac arrest sooner. Number two, get hands on chest sooner. And number three, provide instructions that give us better quality CPR. Mm-hmm. And I think with the latest version of the protocol, actually the latest two versions, 12.2 and 13, over the last 2 or 3 years, we've been able to do that. And software has enabled us now to effectively measure those processes so that we can provide feedback to the dispatcher in real time. When they end a case, it'll actually tell them their hands-on chest time and hopefully, in conjunction with the field crew's efforts, improve survival from out-of-hospital cardiac arrest. There are a lot of other enhancements to the protocol, but I think the recognition, at least this time, is because of the cardiac arrest survival.
Mm-hmm. Is there also, what are the other improvements in BLS especially?
Right, well there's lots of them. I mean, there's basically 32 chief complaints in the protocol. We made a lot of improvements to the seizure protocol to better distinguish what is essentially a benign epileptic seizure from what may be a cardiac arrest. And lots of changes in level of response. Mm-hmm. There's certainly a big concern about having adequate resources and the cost of those resources. And more people in the United States now, this has been happening for a long time in the UK and other places that have been more strapped, but are looking at better ways to triage their resources from dispatch so that they're not firing both barrels of the gun every time the phone rings. Mm-hmm. So.
Well, that's great. Can you tell us about some of the metrics that you've seen, how effective it's been for CPR and especially survival?
Well, in agencies that focus on it, that do it right, is where we're really seeing the changes. It's wonderful to have a protocol. Mm-hmm. We used to have to really work hard to convince people to even use a protocol. Today, that's the international standard of care, and the average layperson really expects you to tell them what to do till the ambulance gets there. Our challenge today is to get people to really use it right, compliantly, etc. So in agencies that we see that are doing this with quality improvement efforts, we've seen hands-on chest times from the time the call comes in drop from 4, 5, 6 minutes down into the 2 minutes and less range, in some cases less than a minute. Wow. Which is really, if you consider every minute of hands-off chest drops survival about 10%, 2 minutes means a lot to that patient and their family.
Yeah. Well, that's pretty amazing. Thank you for telling us about all these improvements in your dispatch system.
Sure, you're quite welcome.
And congratulations again, Brett.
Thanks.
And this is Ryan Kelly for the Journal of Emergency Medical Services, and I'm here with Brett Patterson, one of the award winners for EMS10 Innovations in EMS for 2016.